I'm Kiernan. I'm a orthopedic surgeon here at Milford Regional Medical Center, Orthopedics and Sports Medicine. I'm a specialist in hip and knee replacement. So arthritis is one of the most common reasons for a patient to undergo a knee replacement. And what that is the cartilage, which is the cushion on the end of the bone, gets worn down, leaving behind a hard bony surface, which can be painful to walk on. Now, as arthritis progresses, patients might start to notice limitations in their range of motion, as well as progressive deformity where their knees begin to bow in or out. So arthritis is not just a biological process, it's also a mechanical issue as well. Arthritis is typically genetic in nature, but it can also be the result of prior trauma, surgery, or any inflammatory reaction that may damage the cartilage. So our goal in addressing knee pain is to improve pain and function through the least invasive means possible. So typically that will start with over-the-counter pain medications as well as physical therapy, which is really geared towards strengthening a lot of the muscles around the knee. That can help alleviate some of the inflammatory process as well as maintain your range of motion. During your office visit, we may also provide various injections. The two main injections we provide are cortisone and gel injections. And both of these medications can address the inflammatory process, which is another source of pain. And lastly, there's always the possibility of a nerve ablation, where we're able to use a probe to isolate some of the nerves that provide sensation to the knee and freeze those, providing pain relief for a prolonged period of time. So a knee replacement can be indicated when a patient meets four main criteria. That's one, that they have a diagnosis of osteoarthritis, but also that they've trialed conservative measures and unfortunately continue to have daily pain, discomfort that really limits their activities and quality of life. And once the patients reach that point, then it's a discussion of whether or not a knee replacement can address their goals of care. It's important to understand that knee replacements were never designed for any high impact activities, including running or jumping. However, they are good for managing pain with simple activities such as walking, hiking. They're also excellent at pain relief during golfing or things like pickleball. So a knee replacement begins with an incision over the front of the knee, which is carried down through the capsule, which allows us to move the knee cap up and over to expose the rest of the joint. So there are four components to a knee replacement. There's the cap that covers the femur, one that covers the tibia, the bearing surface in between those, and a cap over the patella or kneecap. So a knee replacement can be thought of really as a resurfacing technique. And during that process, we attempt to restore the mechanical axis of the knee, where it is centered underneath the top of the hip as well as the ankle. There are many ways to achieve that. In my practice, I've found the most reliable and predictable ways are to use computer navigation, which is using a gyroscope and accelerometer to make those measurements as precise as possible. So following a knee replacement, patients can expect to stay one night in the hospital, whereas some actually might go home the same day. Now, we do use a multimodal pain regimen that helps manage patients' postoperative discomfort. That includes anti-inflammatories, nerve blocks, neurologic agents, as well as some opiates as needed. One of the most important aspects of the postoperative recovery is working with your physical therapist. Once you're discharged from the hospital, we'll have a therapist visit you at home and begin working with you on your range of motion and your strength and conditioning. As you progress, you may continue that care at an outpatient facility where they have extra equipment and can help you regain your baseline quality and function. If you develop any knee pain or discomfort, come see us at Milford Regional Orthopedics and Sports Medicine, where we can provide you with both operative and non-operative management options.